All right, Sabrina, thanks so much for doing this. My first question that I have for you is tell the audience a little bit about yourself and how you started in the mental health community.
Sure. Hi, my name is Sabrina, and I am based out of Miami, Florida. And mental health. So I never cared for mental health counseling, never interested in psychology. My major was in business and then public relations. Then I wanted to go for my MBA. And I had like a huge spiritual awakening where God just captured my heart on my 22nd birthday. This was 20 years ago now. And after that, like I had a heart change. And I just had a passion for people, for helping people. I had a hope that I didn't have before I thought this was a very hopeless career and I didn't know how people did it. But I have such a hope and it's just such an encouragement for me. It's kind of like, you know how a construction worker goes or like a contractor goes into a home
Yeah.
and like you know how everything is gutted and he's seeing like, oh wow, I can do this and I can do that, and somebody else goes in and they're like, wow, this is so stressful, I need to get out of here because this is so stressful. I need to get out. For me it's like that emotionally. Like I go, like somebody comes to me and they're a big old mess like we all are, and I just love it. I'm like, yes, there's so much to do here. Yes, like there's so many ways that, I can help, and there's so many things to work on. This is wonderful. We have plenty of work to do here. So I get excited. But I started there through my spiritual awakening where God just really gave me a heart and a passion for people to help them. I help mainly women who have trauma with depression, anxiety. Basically, those are like the main issues: trauma, depression, anxiety, life issues, women's issues. But I started there. And then I worked in the foster care system for 12 and a half years at His House Children's Home. It's a nonprofit faith-based organization dedicated to helping kids get adopted. And while housing, like placing foster kids in the system, they had very like regular homes there with house parents, like a real home, very structured, beautiful. I've also worked for the immigrant children, the all of the children crossing the borders, and they need therapists. They have therapists, they have a medical team, there's everything provided for them. And before they're reunited with family members or friends, we were seeing them. And then I also worked in private practice, and then now I have my own private practice. It's all online, and I can see any residents in Florida.
Mm-hmm. So tell me a little bit about the current work that you do now, particularly with your private practice.
Mm-hmm. Currently, I practice for, I help women, mainly women with trauma, anxiety, depression, life issues, heart adjustments, grief, and loss. Um, Mainly, I use the modality of EMDR. That's the treatment I mostly use. EMDR, I use cognitive behavioral therapy, solution focus, but mainly it's EMDR, which is eye movement desensitization reprocessing. This is basically like EMDR is up and coming. It's great. It's a very effective treatment for trauma. It's very rapid. Some people spend, the work that you do years in therapy, you can do within a year in EMDR. It's very powerful because what it does is it identifies the worst things that have ever happened to you. You think about all the memories, we put it on a trauma timeline, and we start processing each and every one, but there is a process. There's 8 phases in EMDR, and you have to follow the protocol. Not everyone does, but I make sure I follow the protocol. I was very well trained by world-renowned Roxanne Grobel, and it was Insight Counseling. Now it's changed. She's rebranded to Coast Counseling. It's phenomenal. She is all over the country training therapists and providing therapy to people all over. So I was very well trained by her directly. And EMDR is very effective because it's basically like every single memory that you have, every bad memory is attached to a few things. A negative cognition, which is, it could be, I am alone, I'm abandoned, I'm worthless, I'm not good enough. All of those are different negative cognitions, but there's a whole bunch of them that can live in your head. There's different memories that will bring them out. Any bad memory will be attached to a negative cognition. Then you also feel it in your body. I don't know if you know Vander Kolk's book of The Body Keeps the Score. It's an
Mm.
excellent book about trauma and how the body actually stores trauma So every memory is also linked to a feeling that you have, a physical feeling in your body. This is how somebody 50 years later can remember an incident and think, wow, I can still feel my blood boil about that one because it lives in your body unless you get treated. It never leaves. Once it's there, it never leaves unless you receive mental health treatment, unless you deal with that, that in your heart. And it's some deep inner work that EMDR does. So EMDR basically takes the memory and we desensitize the emotion linked to it, the negative cognition, the physical feeling, and any emotions like, oh, I feel angry right now when I think about that. I feel sad. I feel lonely. I feel whatever. It literally desensitizes you so that you can think about the memory now, but you're not emotional about it anymore. And it's all through bilateral stimulation. Okay. There's different ways of that. There's tappers, which in person people use tappers, which they're like these little buzzers in the hands and they tap one at a time because it has to be bilateral on the body. Because I'm online, I use audio. So you'll hear a sound, boom, 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 like one ear at a time. And so there's different sounds. There's the heartbeat, there's the guitar, the bass guitar, the soft flame, the finger snap. There's all kinds of different sounds that you can choose from, but usually the person picks their favorite and then that's what we go with. And then you hear it. It has to be a certain speed for it to work, the taxing memory. And basically it's like, it's not hypnosis. You're aware, completely awake. It's more like daydreaming, but guided daydreaming. Like I start you off with a memory. I tell you, okay, think about that. And then you go and your brain just goes thinking and it doesn't stay somewhere. If it does, I help you to get unstuck. But every 30 seconds to like a minute, I'm checking in to make sure that your brain is still on track processing and not that you're thinking about your Walmart grocery list tomorrow. So that's kind of how it works.
Yeah. Like, is that like kind of is that like the main um modality that you use, or do you alter, with EMDR and other modalities?
I also alter with cognitive behavioral health a lot, CBT. I do that one a lot. I really like that. Solution focus. It just depends on the patient's need. Positive psychology as well. Um, it depends on the patient's needs. It depends, person-centered as well. It just depends on what they're needing. But I'll tell you this, once we start EMDR, it's good to finish. It's good to finish. I try to encourage my patients not to get out of the rhythm. Let's continue on your timeline. Let's continue processing these memories. But cognitive behavioral health would be the other one, to help reframing of thoughts and helping to pinpoint, okay, what is it you're feeling? What's the thought process behind it? Let's work through that. Let's work through these thoughts. And so I use different ones according to the need, but
Mm-hmm.
EMDR is the main one. Mhm.
Yeah. My next question, what I was gonna ask is like in the therapy sessions that you have with clients, what are some of the common themes that you sort of see from patients? Because like you said, you work with people with anxiety, women, and all sorts of stuffs. But what are kind of the main themes in each of those sessions?
Great question. I'm not good enough is the big one, or I'm sad about something, like I'm not a relationship. There's usually like a relationship, a relational issue that's very common, like whether it's spouse, boyfriend, girlfriend, or it could be a work-related relationship, a family member. It just depends. But it's usually like a relationship or triggers, things that, like maybe managing emotions, emotional dysregulation, coping skills needed, stress, anxiety. I have a lot of anxiety. I have a lot of anxiety. I hear a lot. And so when we start to pinpoint, yes, we can name like current situations, but when you're at the point of having anxiety daily, when it's affecting your daily functioning, it's a buildup of many years. That doesn't happen overnight. There is a buildup that has happened. And 9 out of 10 times it's coming, there's things happening, building up in there from childhood. Nine out of 10 times. It's stuff that happened way long ago, and little by little, there's a buildup and a buildup. And before you know it, you get to a place where it's too much for your body, it's too much for your emotions. Your tolerance grows lower as time goes by. Time does not heal all wounds. Only if you've been working on those wounds and treating those wounds, but time will not heal wounds. So it takes work and self-awareness.
Mm-hmm. My next question is in so for those people who have those kinds of issues that we talked about, how do you sort of facilitate this idea of like I see you, I hear you, I get what you're coming from, that kind of thing?
You mean compassion and empathy?
Yeah.
I'm sorry, what's the question?
Yeah, how do you make sure that clients feel seen and heard and that kind of
Hmm.
they're understood? Because oftentimes, when people, go see a therapist, they often have to find the right fit, right? So
Yes.
that's what I'm asking. Yeah.
Got it. Okay, good question. Validation, a lot of validation. Like, I hear you, I see you, it's reasonable why you're feeling what you're feeling. Anybody in your position would feel that way, given the circumstance, given that situation, given that, given this, given that. Like, validation, really, and non-judgment, like no judgment. There's a no judgment zone, being non-judgmental. I'm not here to judge you. I'm here to help you. I'm here because I care to help you. So it's making sure that, like, I repeat back, is this what you're saying, or is this how you're feeling? Like, giving feedback too, as far as like what I'm understanding. And the person's like, yeah, 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 it's like that. Or sometimes I'll even help them to like put words to what they're feeling, because sometimes people can, like, they're trying to explain something, but they can't really verbalize what they're trying to say. And I can help them do that too. And then they feel understood because they're like, oh, yes, that's what I'm feeling. Yes, that you're putting into words what I'm trying to say. Sometimes people need help putting into words their emotions. Most of us are not taught growing up how to express ourselves. How do you express yourself in a healthy way? How do you talk about things? How do you talk about your emotions and your feelings? It's the contrary. So growing up, you're taught, don't cry, here's a tissue, stop the tears. So it's
Exactly, yeah.
mhm.
Because my next question is, I always ask therapists this, like, what have you learned in doing this kind of work with patients?
Wow. Okay, that's one to think about. What have I learned in doing this kind of work? I've learned that we are all broken. We are all broken. And everybody has such different situations, but you can still feel the same, you could still have the same negative cognitions and the same emotions, totally different circumstances, totally different situations, totally different upbringings, totally different everything. But you could still, we're all humans, we're all broken humans who we all need help. We all need community, we all need love, we all need care. So that's what I've learned.
Like in terms of, what do you terms in terms bleh, what do you hope to learn in terms of something new as a clinician? Is there anything new that you want to explore further?
Yes, in EMDR, I really do want to learn that better, how to use the cognitive interweaves. Right now, I am in the process of certification, which I'm anticipating that by the end of this year. That's like basically expert EMDR. That's the highest certification. That's the highest level of EMDR that you can get to in the training. It's not just EMDR therapist, EMDR trained, but EMDR certified. And so I really want to learn how to help people break through when they're stuck. Like, I want to become an expert in that I can unstick anybody. Anybody who gets stuck, I can help them. Some people are harder than others because some people think they're ready to deep dive and to dive deep, and like they're not ready. They realize in therapy that they're not ready, or maybe they don't even realize they're not ready, but they're resistant. There's a lot of resistance. I want to learn how to, number one, better filter the people who are not ready, and number two, being able to use like the cognitive interweaves to really break through when somebody is resisting and stuck, which I do IFS parts work. For that, I help them get unstuck through the parts work. So a lot of times, it'll come out that people do need to do parts work first, which I also do that with them. So that's, I've been able to help a lot of people break out, but not 100%. I want to
Hmm.
get to like 99%.
Yeah. My last question in all of this is, what advice would you give to people, who want to study EMDR or who want to like enter the mental health field? Because I have to say, I've interviewed mental health professionals, other mental health professionals, and it's fascinating. So it's really good stuff.
Mm-hmm. It really is. It's a very special career. I love my job. I love what I do. I thank God every day for my job. People encourage me. They're an encouragement to me. I'm encouraging them. And I just seeing their progress is such an encouragement to me. Um, I would I would greatly advise for anyone thinking of studying this, you have to have a heart for it. You have your motive has to be right why you're studying this. You have to have a heart to help people. You have to have compassion and empathy. That's not something you can learn in school. You have to have a true heart to help people. You have to want this for the right reasons.
Yeah. All right.